Okay. Dr. Jim Squire is going to moderate the panel. And how did you want to have, do we have any microphones for people to come and speak at? How are we doing this?
Can people hear? Okay. It looks like there's no microphones on the side, so I think people just stand up and...
Oh, they can walk that around. Channel your rebel energy.
So I can run this to anybody.
Okay, so I think maybe what we could do is have people can line up on either side if they have questions. I would request that people keep, because we're late on time here, we can go overtime. We don't actually have to be out of here until about 9:45, so we can actually go as long as people want to ask questions. I just request people make their questions or comments short, about 30 to 45 seconds or something like that, and they can direct the question to the whole panel or to a specific individual. And I'd also request people who might be new to single payer or shy about asking questions to definitely come forward with your questions, because one of the weaknesses that we have, I know Carol talked about some of the weaknesses of PNHP, is that we're very used to preaching to the choir, and we want to get new people to ask questions, and I think that's very important. So why don't we start over on this side?
Okay. I have a question about the effectiveness of certain political action. And I've heard these themes come up tonight in this conversation, and I want you to know that I've been a political activist my whole life. I'm not a doctor, I'm a dancer. So life has been different. But I ended up with an illness, and that's how I got more and more involved in working for healthcare for everyone, even though I've believed in it forever. Number one is, if we control the narrative, which has been something that's been brought up, we need to control the narrative. If we create a proactive rather than a reactive movement, another issue that's been brought up, let's be proactive. Let's stop reacting to them. Instead, let's present something ourselves. And if we want to humanize our opponent so that we're not just calling names and participating in the same gross politics and cruel politics that right now dominate our country, then what do you think about the constant use of the metaphor of war, where we're all fighting one another about something? Metaphor has an incredible amount of impact on people's psychology. And I know that as an artist, having created incredible pieces of art for the stage. So why do we keep using that metaphor, and what do you think that metaphor, how that metaphor impacts all those other issues?
Who wants to take that?
Should I start? Okay. I'm a Quaker pacifist and therefore not into war. On the other hand, conflict is a basic force in human life. And I actually agree with Gandhi. His view of conflict was that it was a positive when it's waged in particular ways, because it enables people to become more creative and to evolve on a higher level, so that there's a higher level of organization in which there's more justice. Or his favorite word was truth. That is, that more truth comes out of waging struggle if the people engaged in the struggle are willing to fight with each other in a human way. and not in the way you're describing, in which people reduce each other to, whatever, but instead acknowledge their humanity. So, for example, the organization I referred to that stopped the seventh largest bank in the United States from doing this terrible thing, we never shouted names at the executives. We dropped by his house and engaged with him for an hour in his doorway on July 4th. We figured he might not be at the office. And very civil discussions. At the same time, we disrupted the operations of the bank and really hurt their brand. Because their brand was calculated to attract customers to them on the basis of their great responsibility. Well, how responsible is it to blow up mountains, double the cancer rates of people there, increase birth defects? That is, talk about, right? But, we're your responsible bank, so you should be a depositor, right? So we had to, in order to advance the truth, we had to expose constantly and spotlight their injustice and their violence. But we didn't have to, when we'd run into them, we certainly didn't have to abuse them. Abuse is never justifiable, I don't think. So I'm very fine, on the other hand, with people being very honest with me in what they think about what I'm doing. Because I can learn from that. And I want to give that same respect to other people, especially grown-ups. It's not like I want to deal that way with children. But with grown-ups, I want to say, you are doing something really terrible. And the consequences of your action are X, and you've got to stop doubling the cancer rates of people in Appalachia. You've got to stop that. You've got to stop that now. And that way of waging conflict or struggle is okay in my book. I wouldn't call it the same as war, which is actually injury. You know what I mean? Yeah. Of work?
Using the language of
Well, because we're not working together. No, they're working for profit, right? They are working for profit. They have a different goal. When they go to work, they have that goal. I have a different goal. So I'm not working with them at all. I'm actually working to undermine their ability to do their work, because their work involves doubling the cancer rates of people in Appalachia, and I want to undermine their capacity to be able to do that. You see what I mean? I'm sorry? Yeah, I'm working against them. Yeah. But for me, war has, the reason I'm so opposed to war is it has to do with actual injury of others. And I'm not really into injury and death. I don't like that at all.
Hi.
Okay, I'll take one question here, and then, do you have a question there? I do. Okay, so let's go here, and then we'll go there, and you can just speak up.
I would like to ask a favor. Would everybody under the age of 35 please stand up?
Yay, Max.
Thank you, Millennials. Thank you, Millennials. That was kind of taking on the theme of Jim's preaching to the choir. I attended the Healthcare Now conference in New York. And one of the things that they said there is we have to engage millennials. Who do you think are the rebels right now in this room and in our cause? Okay, I'm not trying to be insulting. What I'm trying to do is say we have a lot of outreach to do. And it's not going to happen in this room. And it is going to be reaching out to our younger people and helping them become involved and talking to them. One of the things that I heard was at that conference, and I've heard a lot here, is initiatives never work. You can't do an initiative. We've been putting, or this group has been putting a bill to the state legislature for 20 years, and it has failed every year. We're trying to do that, and we're getting a lot of pushback, and we're not getting the coalition building. How do we do this? How do we tell them that we're here to build what you are talking about? We're here to help create the conflict. How do we get the older generation, which I am one because I'm 58 years old, to help bridge this gap and help embrace the rebels that are out there waiting to be tapped?
Well, I would just like to let everyone know that the Students for a National Health Program component of PNHP is the fastest growing component of PNHP. We have over 40 medical schools with SNAP chapters. I'm happy to say that in Tennessee, we have chapters in every medical school except sort of a fledgling one at Meharry. And I just got an email today from a Meharry medical student that I met at the town hall a couple of weeks ago, asking me if I would help her go on a student outing to study the healthcare system in Cuba. And my intention is to reply to her, I will give you money to do that if you will get a SNAP chapter started at Meharry. And I think we'll be able to negotiate that. So I agree with you. It is a point well taken. And one of the reasons I'm so keen on engaging medical students and undergraduates as well in this movement is because I don't want them to become tired, burned out, exhausted mid-career and late career physicians who have lost their way. So it is a point well taken.
I'd like to expand that question a little bit and not give up the thought that older people than 35 can make a big difference. Look at Quentin Young, for instance, up to his late 80s. And I was asking George here about how he would, as you probably know, in Iceland several years ago, there was all women didn't go to work on a certain day. And it just brought that population to a standstill. It changed everything right now. Now there's a woman prime minister of Iceland. It just changed things now. So, George, what can you tell us about healthcare in this country and what people of any age just about can do?
Well, right, the women did such a dramatic thing, right? Because if you overlook women's work and then they don't show up for work, then you see the work that doesn't get done. So it was very smart. And there's examples of medical people doing equally dramatic things. I'm thinking about interns in California. I wish I could remember the city. Interns in a hospital having a heal-in and announcing ahead of time, anybody you know who has an ailment or has something that they need addressed by a medical person, have them come next Wednesday. And then these interns admitted all these people to the hospital. The hospitals were full of, corridors packed, a closet, the entire place was totally full of patients. And it was a very dramatic moment, right? Because, so it's an example of, we can have a statistic and it's very meaningful to us as an illustration of how crazy the healthcare system is. And on the other hand, the statistic doesn't mean anything to people out there, and therefore doesn't grow the movement in a way that, say, a strike or a heal-in or something of that sort that's quite dramatic and visible and vivid will do. And the point of that is not that incident will then translate into shift, but that thing will grow, provides us the opportunity to grow. And we need a growing movement that does more and more of that kind of thing, and it's increasingly disruptive to the point where we can push the elite out of the way.
My question has to do with people who are already in the healthcare field and have been involved in it either as providers of care or in support groups or whatever, supporting that function. And their ability to stand up and speak what's on their mind. They see
problems that are happening in healthcare, but because recently all of practices have been tied to hospitals, they reach out and have gathered in all the specialty groups, and they're all tied now into these huge consortiums of medical delivery, and it makes it very hard for them to stand up and speak out and say the truth that they see about the medical care that is not happening, and the viability of this continuing on. And so my real worry is that even though people are able to see the problems, they cannot get the cachet to get going. They're afraid they're going to lose their jobs, lose their livelihood, not be able to affect change.
I'd like to respond to that first. That's a huge problem, I think, and I've been very critical of my colleagues in organized medicine, virtually in all specialties. In family medicine, I'm disgusted at what the American Academy of Family Physicians, which is a lot of people, do with their annual meeting. It's a pharma exercise with all the lobbyists, pharmaceutical countries there. They even had a president for 1 year who was a single payer guy. He didn't get anything done. So there is movement. The American Psychiatric Association is strong on universal health care. The oncology groups, some of the oncology organizations that see the huge crisis in cancer care, they're becoming more active. 2 months ago, the editor of the Journal of AMA actually, in an editorial, said he's for universal health care. That's the first time that's ever happened. They've been reactionary in the AMA since 1918. So I'm very critical of that. But you're right, 64%, I think, is the latest number of U.S. physicians are employees of employers that are usually expanding health hospital systems. In California a few years ago, an insurer, a big one down there, bought up 2,300 docs in primary care. I mean, so it's a big problem, but I think physicians have to stand up, and there are ways, and heal-ins are interesting. Some labor activity or unionization among physicians is a possibility. I don't know. What do you think?
Well, actually, I think that being part of a large organization gives you an advantage. You have so much more ability on a day-to-day basis to interact with your colleagues and influence them. I worked in a solo private practice, and in a small community, well, it was a large community, but I was the only private practice psychiatrist. So I often felt that I wasn't having as much of an impact, or that I would have to do an action that was sort of bigger than it would have had to have been if I'd had more colleagues working in unison with me and doing it together. One of the things that I did do that was effective was I got from a group called Farmed Out, I got a big sign that's a circle with an X through it, and inside it said drug reps. And I put it on the front door of my office, and it truly meant that if a drug rep entered my office, they were trespassing. And they were so upset by that they went to Bob Conkle, Dr. Conkle, who was the inpatient psychiatrist at St. Mary's Hospital, and said to him, "What do we have to do to get into Dr. Paris's office?" And he just burst out laughing and said, "You haven't got a snowball's chance in hell. You might as well just give up." On the bottom of every one of my bills that went out of my office, it was printed, "Dr. Paris supports a national health program. To learn more, go to www.pnhp.org. Every piece of paper that went out of my office had that statement on it. So I think that there are ways to do this, And I would actually say that being in a large group, I'm hard pressed to say anybody's going to lose their job because they speak in support of when, you know, take the high road. I'm going to take a risk here and say I think that's more of an excuse than it is a reality. And I can tell you that I got arrested twice, and I was able to get my medical license renewed, my malpractice insurance renewed. There wasn't a problem.
Okay, we have one last question here.
Wait, I got a question after the last one.
So the penultimate question will be from me, and it is basically about, I want to know what your thoughts are about the limits of nonviolent direct action, and as far as them, you know, it could be disruptive in nature, but where do we go from nonviolence into coercion, which may be seen as a type of violence itself? Thank you.
Yes, that is a philosophical debate whether coercion is nonviolent or not. But I think certainly in the field of study, coercion is well understood to be that coercion can be accomplished through violent pressure on people or through nonviolent pressure on people, and people can nevertheless be coerced. That is to say, act against their will because they've been nonviolently forced to do so. There was even a book as early as 1923 by a sociologist called Nonviolent Coercion. Gandhi himself said, let's face it, the British Empire is not in India as a good works project, you know, charitable enterprise. It's a deadly, he used the word deadly business proposition for them, and they need to be coerced out of our space. So the preponderance of thinking about nonviolent action is that what we're mainly about is coercing. That is to say, in the case of the bank wanted to keep making money on it. We forced them out of that business because when they added up the costs and, you know, benefits, they realized we better get this this group called Earthquaker Action Team. We better get them off our backs.
I'd like to make one comment related to and parallel to, but I find it fascinating that now that the GOP bill has been pulled twice from the House without a vote, and the Republican Party in Congress is totally spooked, and the AMA and the American Hospital Association are coming out. We really need the ACA, the Affordable Care Act, still here, but there's this battle about the ACA or the GOP bill, but they're really spooked in the whole medical and medical industrial complex and hospitals about where will the patients be if either Tom Price takes apart the ACA or the GOP gets in and wipes out the safety net. But so I think it's a great opportunity right now is what I'm saying, because the American Hospital Association wants its hospital beds filled, and Medicare for All will do that.
Yeah, there's a whole lot of progressive organizations out there now, and many new ones engendered by the Trump Republican threats and agenda. And there's always been a struggle between progressives about which organizations are going to work for incremental changes that are, quote, considered possible, and others that are working for what we really need, which may be more difficult. So we, I think, understand that we need a movement of movements, but how do we get these organizations that have a different strategy working together to really create a genuine movement of movements?
Well, there's a common sense thing that I find sometimes effective in dialoguing with incrementalists, and that is to say, is to agree with them that politics is the art of possible, and it's the art of compromise, and that's how things actually work. The sausage that gets made in Washington is done through compromise. But I ask the question, is it better to compromise after you've struggled as hard as you can and gone as far as you can in your struggle, or is it better to compromise in the beginning, before you've struggled? And what's really striking, even Bernie Sanders is playing with this one, that it might be better to compromise first before you struggle. And that strikes me as a completely uncommonsensical approach. It's strategically, right? So I think in actual dialogue with people, we could just ask them, are you going to get farther if you compromise first? Or if you struggle and empower yourselves and then compromise at the end and see what happens?
And I think the whole idea of compromise is a political issue. We're not politicians. We are the movement. We are the people. So Margaret Flowers taught me a great acronym, ICU. It stands for independent, clear, and uncompromising. That's what we need to be. We are not the politicians. We're the movement. We're the people, and we're the power.
Okay. Sally has a question.
Many of us have been going to town hall meetings, and some of the representatives of the four Congresspeople and the four Democrats in the state who have not signed on to 676. So we've been working on them, and one of their answers that comes up is that they can't say that single payer is not the time, but the public option is a possibility. And what would you say back to them?
Okay.
The public option is a terrible idea. And I'll explain why. It's a terrible idea because it sounds like a good idea. And the reality is that when the public program competes with the for-profit insurance companies, I guarantee the public program is going to lose. And the reason is because the for-profit insurance companies know how to game the system, and they've got all the money in the world to do it. They know how to cherry pick the healthiest people into their plan and lemon drop all the sick people into the public plan, which then fails because it's got all of the sick people in it. So a public option is a terrible idea. And that would be an
totally
example
agree.
of compromise for what?
I
mean,
agree.
thank you.
It's a total failure. It never would work, though it sounds to some politically attractive, but no, it would be terrible. I want to relate one thing that just happened in Iowa. There's a patient, a single patient with a complicated genetic disorder whose expenses are $1 million a month. And the dominant insurer in Iowa is Blue Cross Blue Shield plan, and it moved out of state right away. But along the line, as I understand it, it would take a risk pool of, this would have wiped out, that one patient would have wiped out a risk pool of 30,000 people. So the whole deal is get the hugest risk pool you can, like 320 million.
Could I just mention, I know we're headed toward closing, but I'll be at the table over there, happy to sign books about the healthcare program and other aspects of the Nordic model.
Okay, will use my prerogative to ask the last question here. One thing, in the single payer movement, we sort of are going for the whole enchilada. We want HR 676 or we want a state plan. So we're sort of, we want it all as soon as possible. And this is sort of directed to George, but the other panelists can talk also. You talked about being sort of more specific and directive, like having a very specific campaign against a very specific object or something that's objectionable. And when we were talking last night, you were talking about, well, how come like with the high prices of pharmaceuticals, you don't like pick one of the hepatitis C drug companies and like target them and like make their life miserable and try to get a victory in that way as one way to build the movement instead of like going for everything. So I was just wondering, it would be a different approach in terms of the organizing that we might do in PNHP. So I was wondering if anybody here had any ideas of other things we could do that would be, I guess you could consider kind of incremental, but would help to build the movement, but it wouldn't be single payer in and of itself.
My favorite one of that kind is the EpiPen because my life depends on it. And I want an EpiPen I can afford. And you know about jacking up the price and that kind of thing. Putting people's lives in danger for greed. I mean, how obvious. The thing is, what most people need to feel in their hearts in order to join our movement is things like that, things that are really, really vivid. I mean, it's great for analysts to be able to draw a big picture and be abstract, but for building a movement, it's that cup of coffee. Now, people understood that when those students asked for a cup of coffee, I mean, some of them didn't even like coffee, right? So they understood this was about racism. This was about freedom. In fact, the movement ended up calling itself the Freedom Movement. I'm talking about big picture, right? But they grew their movement through demanding cups of coffee. They grew their movement through saying, we want to be able to use the town's swimming pool. That is not incrementalism. That is movement building through targeting, through demands that make vivid in local application the larger systemic problem. And it just is some proportion of the population, I don't know what, 80% or something of the population, that are not systemic thinkers. I mean, most people are hit in the gut by something that is outrageous, like making people die because they can't afford an EpiPen. So the way to build the movement, therefore, is to go to people's, place of vivid feeling and empathy and say, this matters. In fact, you probably have somebody in your extended family that is paying too much for medication or is choosing between paying the rent and paying for medicine or eating or paying for medicine. And you need to stand with us. That's called movement building. When we get a big enough movement, then we can make real. I'm not saying abandon the single payer, goal as an overall goal any more than the freedom movement abandoned the goal of racial integration, but that each case point then builds the movement to the point where we're powerful enough to get what we want. And so our power is the route to getting that vision, in my view.
Okay. Right now, there is so much upset in the general public that groups and actions are coming at all of us every day. In a way, it's like drinking from a fire hose. That's what my email inbox and my email junk box look like every day. I don't know about you guys. We have to find a way to bring people together to cooperate on manageable actions that can be successful. That's what we've been talking about here tonight, is ideas for how we do it. We will need help from each one of you in the weeks and months ahead as we plan activities. So be sure that we have your contact information so that you can be included. Okay. I'm sure everybody's getting tired, but are you all fired up? Yes. Ready to go do something? Yes. Together? Yes. Healthcare activism now. Everybody in, nobody out. Medicare for all. Everybody in,
nobody out. Medicare for all.
Thank you.